I'm just going to start out with a small symptom that we see in the pulmonary and in the respiratory offices all the time, and that's somebody who coughs. And he comes in and he says, I have coughed now for 4 years, and I have negative x-rays, negative white counts. They've tried inhalers, and nothing ever works. And one of the first things we do is do a CAT scan. And a CAT scan is the only way that you can really tell if there is something there called bronchiectasis. So bronchiectasis is it's a variant of bronchitis, and it is defined as dilatation and destruction of airways. So the airways normally taper out nicely toward the end of the edge of the lung. In bronchiectasis, they get injured, some of them, and those airways never taper. They become wide. Their protective covering, the cilia, gets wiped away, and they're ideal growing spots for different types of bacteria. And those bacteria can be quite potent. When the bronchial tree gets large, secretions that normally are there to protect you start pooling. They don't clear as well. And that is another area for infection to fester. But remembering that you can have airway clearance problems from lousy immune system, and that brings in all those other bacteria, and remembering that all of this is quite treatable. So let's say you do a CAT scan and you culture, and then you approach the diagnosis and treatment based on those cultures. In addition, especially respiratory therapy has to be involved in airway clearance. Now we have breathing treatments that shake up the insides of your airways. We have acapellas and various vibration devices, including a vest that vibrates your lung like that and shakes up the secretions in these airways so that you can better expectorate them. Some of the treatment, especially for the Pseudomonas and especially for the NTM, can be inhaled, meaning through a nebulizer. So it's antibiotics through a nebulizer for both those diseases, especially if they're really bad. And those who don't even respond to that, next turn is IV medicine that can be given at home. So anyone who coughs for a little while and it doesn't seem to go away deserves to be evaluated. But that it's more than a day, it's more than a week. People with bronchiectasis cough all their lives. So we have all the tools. We have a great respiratory therapy department. They are attuned to pulmonary toilet, they call it, cleaning those airways, vibrating the airways, helping you to get rid of all that extra mucus, helping with the cultures, using various medications, whether they be nebulized or not, and that helps us to clean up the person with bronchiectasis. And this is not a fatal problem, but it's an extremely bothersome problem and extremely common.